Welcome to Theme 4. In this video, we will discuss how to schedule follow-up visits and what should be done at each visit. In terms of PrEP monitoring, we will firstly go through what the schedule of the follow-up visits looks like, and then we'll go through what is done at each follow-up visit. The schedule is relayed as having a follow-up visit 1 month after initiation and then every 3 months thereafter. Note, every 3 months is a clinical visit where the patient is required to see a clinician, a nurse or a doctor. At these visits, patients will get 3 months worth of PrEP scripted, but will only be given 1 bottle of oral PrEP per month. They will be required to pick up their monthly supply for PrEP every month. Month 1 visit. The intention of the month 1 visit is to check in on side effects and how the patient is coping, as well as to make sure to do an HIV test to ensure that we did not initiate someone in the window period. At the 1 month visit, we repeat the HIV test, we do HIV screening, provide education, do adherence counseling, provide condoms and other contraceptive methods, and do STI screening. No additional bloods are required. The patient will be given a script for 3 months for monthly PrEP collection. Although the patient will come in at month 2 and 3 to pick up their PrEP supply, they do not need to have a clinical visit, and no tests are needed during those visits. At the 3 monthly visits or quarterly visit, an HIV test is repeated, STI screening is done, side effects are assessed, and management is done. Adherence counseling is also done. Behavioral risk reduction counseling is done, and contraception should be provided. Please note that the creatinine blood draws are repeated at month 7, i.e. 6 months after PrEP initiation, and thereafter annually. Note that hepatitis B testing is not repeated. This is a very simple follow-up procedure and is not a complicated schedule. It is important to explain to patients that although they have a 1 month follow-up visit after initiation, thereafter we will only need to see them 4 times a year. We will now address what to do if any of the results at a follow-up visit are abnormal. If at any stage someone tests HIV positive on a rapid test, stop oral PrEP and follow the national HTS guidelines. This means doing a repeat rapid. If someone is confirmed to have seroconverted, PrEP should be stopped immediately and the patient should be referred for prompt ART initiation, following the Department of Health's testing guidelines. Remember, transitioning from PrEP to ART treatment without a gap is recommended, and therefore same-day transference from PrEP to ART. It is recommended that you initiate them on first-line therapy. If you have discordant results, i.e. 1 positive rapid and 1 negative rapid, follow HTS guidelines and oral PrEP should still be stopped. If a patient tests HIV negative but has signs and symptoms of acute HIV, you do not need to stop PrEP. Instead, bring the patient back and repeat an HIV test in 2 weeks' time to ensure that they are not in the window period. If the repeat rapid after 2 weeks is positive, stop oral PrEP immediately. If someone suspects that they may be pregnant, repeat the pregnancy test at any follow-up visits. Women that are high risk who become pregnant while on PrEP may continue taking PrEP during their pregnancy, provided that they are adequately counseled. Ideally, they should be monitored throughout the pregnancy on the pregnancy register. If a patient comes in with signs and symptoms of an STI, continue with treatment as this does not interact with PrEP. Also, remember to recommend condom usage, reminding the patient that oral PrEP does not protect them from other STIs. The last abnormality that may be seen in the oral PrEP follow-up visit is a low creatinine clearance. If a patient has a normal creatinine clearance at initiation, but at month 7 their creatinine clearance is less than 60, PrEP must be stopped, and the creatinine clearance should be repeated 2 weeks later. If after 2 weeks the creatinine clearance has returned to normal, PrEP may be reinitiated. If the creatinine clearance remains below 60 mL per minute, please refer the patient for further investigations for renal dysfunction. Visit 1, screening and initiation. Confirm HIV status, adherence counseling, creatinine clearance, STI screening and treatment, behavioral sexual risk reduction, PrEP scripted, PrEP dispensed, pregnancy tests, hepatitis B. Month 1 visit. Confirm HIV status, adherence counseling, STI screening and treatment, behavioral sexual risk reduction, PrEP scripted, a 3-month script, PrEP dispensed, 1-month supply given to pick up rest of script monthly, pregnancy test if indicated. PrEP pickup, 1-month supply given. Month 3, PrEP pickup, 1-month supply given. Month 4, confirm HIV status, adherence counseling, STI screening and treatment, behavioral sexual risk reduction, PrEP scripted, 3 months, PrEP dispensed, 1-month supply given to pick up rest of the script monthly, pregnancy test if indicated. Month 5, PrEP pickup, 1-month supply given. Month 6, PrEP pickup, 1-month supply given. Month 7, 6 months after initiation, confirm HIV status, adherence counseling, creatinine clearance drawn, STI screening and treatment, behavioral sexual risk reduction, PrEP scripted, 3 months, PrEP dispensed, 1-month supply given to pick up the rest of the script monthly, pregnancy test if indicated. The cycle then repeats. It is important to note that the creatinine clearance test happens at the month 7 visit and then annually thereafter. So how do you manage a positive HIV test, signs of acute HIV, STI symptoms, or a low creatinine clearance? Stop PrEP and transition the patient to first-line antiretroviral therapy. Managing seroconversion. If a person using PrEP tests positive for HIV, PrEP should be stopped immediately and the person referred for prompt initiation of HIV treatment, following DOH guidelines for testing. Transition from PrEP to HIV treatment without a gap avoids the risk of resurgence in the viral load, immunological injury, and secondary transmissions. Most people who seroconvert on PrEP will be able to use standard first-line antiretroviral therapy. Don't stop PrEP. Do an HIV test using the HIV testing algorithm. If the test is negative, repeat the test in 2 weeks. Treat with syndromic management. If the creatinine clearance is less than 60 mL per minute, stop the PrEP and repeat the creatinine clearance in 2 weeks. If after 2 weeks it remains low, do not restart the PrEP. If the creatinine has returned to more than 60 mL per minute, you can restart the PrEP. Remember, in patients whose creatinine clearance remain below 60 mL per minute, to work up for common causes of renal insufficiency. For example, diabetes, systemic hypertension, preeclampsia during pregnancy, hepatitis C infection, or liver failure. When is it safe and appropriate to stop using oral PrEP? Oral PrEP must be stopped if you have a positive HIV test, if there are safety concerns, particularly that the creatinine clearance is less than 60 mL per minute, or if the risk outweighs the potential benefits. The other important reason to stop PrEP is when a client decides to stop. It is important to counsel them effectively and explore alternative prevention methods and risk reduction strategies with them. Remind them that they can stop and start PrEP as they please, but they will be required to have another HIV test when they are reinitiating in the future. It is also important to emphasize the fact that PrEP needs to be taken for at least 28 days after their last potential exposure to HIV. It is quite possible to cycle on and off PrEP, but it is important to remember oral PrEP is not intended to be a lifelong intervention, and oral PrEP should only be used during periods of risks when someone has potential exposure to HIV. We expect people's risk levels to change over the course of their lifetime, and people will want to use oral PrEP for a variety of different reasons. It is important to remember to educate patients on prevention, effective adherence, and that cycling on and off PrEP is not considered non-adherence. When someone decides to stop oral PrEP, it is important to counsel them effectively on the following. Remind them that it takes up to 7 days of daily dosing with oral PrEP to achieve protective levels, and during this period, protective precautions must be used, such as condoms. This needs to be taken into account in users who stop and start oral PrEP during their periods of risk. Also remind them that they should continue oral PrEP for at least 28 days after their last potential exposure in order to protect themselves from said exposure. We have come to the end of the video for theme 4. One more theme to go. In the last theme, we will discuss what is required during follow-up counseling sessions. Remember to answer the questions before moving on to theme 5.